You hear a doctor discussing a patient's treatment plan with a nurse.
We've started Mrs. Patel on the new antihypertensive medication, but she's been experiencing some side effects. She reported dizziness and nausea, particularly in the mornings.
Should we consider adjusting the dose?
Not just yet. I'd like to give it a bit more time to see if her body adjusts to the medication. In the meantime, make sure she's getting up slowly to avoid any falls and monitor her blood pressure closely.
Understood.
You hear a physiotherapist talking to a patient after a session.
You did really well today, and I'm pleased with your progress. The exercises we went over are absolutely essential for your recovery, especially those that target your lower back. These exercises are designed to strengthen the muscles around your spine, improve flexibility, and reduce the risk of further injury. It's important that you make them a part of your daily routine. Ideally, you should be doing them twice a day, once in the morning and once in the evening.
I will definitely keep that in mind. But I'm a little concerned. After doing the exercises, I noticed I felt a bit sore. Is that something I should be worried about?
A bit of soreness is completely normal, especially as your body adjusts to the new movements. It's a sign that your muscles are working and beginning to strengthen. However, it's important to differentiate between normal post-exercise soreness and pain that's more intense or sharp. If you ever feel pain that's more than just mild discomfort, you should stop the exercises right away. It's possible that we might need to adjust the intensity or modify the exercises to better suit your current condition. Just keep me informed and we can tweak your routine as necessary to ensure your recovery is both effective and safe.
You hear a nurse briefing a colleague before the end of her shift.
Just a quick update regarding Mr. Jenkins. He's scheduled for his next dose of IV antibiotics in about an hour. So far, he's been responding well to the treatment, and his infection markers are starting to come down, which is a good sign. However, he's mentioned a few times that he's experiencing some discomfort at the IV site. I took a quick look earlier, and it doesn't seem too alarming, but it's definitely worth checking before you administer the next dose. We want to make sure there's no irritation or infiltration that could cause further issues.
Thanks for the heads up. I'll definitely take a closer look at the IV site when I'm in there. If there's any redness, swelling, or anything that seems off, I'll assess it and decide if we need to relocate the IV or take any other steps. I'll also make sure he's comfortable and see if there's anything else we can do to alleviate the discomfort.
Perfect. Let's just stay on top of it so we can continue his treatment without any complications. If you notice anything unusual, let me know right away, and we can address it together.
You hear a consultant talking to a medical student during a ward round.
Mr. Hughes presents an interesting case, illustrating the importance of adopting a holistic approach to patient care. His physical symptoms, such as his blood pressure and pain levels, are currently well controlled with the treatments we've implemented. However, it's becoming increasingly clear that his anxiety is playing a significant role in hindering his overall recovery. Despite the fact that his physical condition is stabilizing, his heightened anxiety is likely impacting his ability to rest, adhere to his treatment plan, and engage fully in his rehabilitation. This is a classic example of how mental and emotional health are deeply intertwined with physical well-being.
I understand. Given his anxiety, should we consider adjusting his medication regimen to help manage it better? Perhaps a low-dose anxiolytic might be beneficial?
That's a valid consideration, but I don't think medication adjustment should be our first line of action in this case. Before we introduce any new medications, let's focus on addressing the root cause of his anxiety through non-pharmacological means. We'll bring in the mental health team to provide additional support, perhaps some counseling or cognitive behavioral strategies that can help him manage his anxiety more effectively. By doing this, we can see how much of a difference these interventions make in his overall progress. If we find that his anxiety continues to be a barrier despite these efforts, then we can revisit the idea of adjusting his medication. But for now, let's prioritize a more integrated approach to his care.
You hear a dietitian discussing a meal plan with a patient.
With your recent diagnosis, managing your sodium intake has become crucial to your overall health. Excessive sodium can exacerbate your condition, leading to issues like increased blood pressure and fluid retention. To help you manage this, we've developed a meal plan that emphasizes fresh, unprocessed foods. These are naturally lower in sodium and better for your health overall. I'd also strongly advise you to avoid ready-made or pre-packaged meals as much as possible. These often contain hidden salts and preservatives, even in products that might seem healthy at first glance.
I understand, but does this mean I need to stop eating out completely? I enjoy going to restaurants and it's a big part of my social life.
You don't have to give up dining out entirely, but it will require some extra mindfulness. When you're eating out, I recommend opting for dishes that are grilled, baked, or steamed, as these cooking methods typically don't require as much salt. Be sure to ask for any sauces or dressings on the side. Restaurant dishes often have more salt than you might expect, so having control over how much you add can make a significant difference. You might also want to ask the restaurant staff if they can prepare your meal with less salt, which is a common request they're usually happy to accommodate. By making these small adjustments, you can still enjoy dining out while keeping your sodium intake in check.
You hear a pharmacist explaining a new prescription to a patient.
This medication needs to be taken once daily, preferably with food. Taking it with a meal helps to reduce the likelihood of stomach upset, which is a common side effect for some people. It's also crucial to take the medication at the same time each day. This consistency ensures that the medication remains at a steady level in your system, which is important for its effectiveness. For example, if you choose to take it with breakfast, try to take it around the same time every morning.
I'll make sure to do that. But what should I do if I accidentally miss a dose? Sometimes my schedule gets hectic, and I worry I might forget.
It's understandable life can get busy. If you do miss a dose, the best course of action is to take it as soon as you remember. However, if it's already close to the time for your next scheduled dose, it's better to skip the missed dose altogether. In other words, don't double up on your next dose to make up for the one you missed. Doubling up can increase the risk of side effects and doesn't necessarily improve the medication's effectiveness. And to help prevent missed doses, you might find it helpful to set a daily alarm on your phone or use a pill organizer. These small steps can make a big difference in maintaining your medication routine and ensuring the best possible outcome for your treatment.
You hear a midwife discussing a birth plan with an expectant mother.
We've covered the main aspects of your birth plan, but there's one more important topic we need to discuss: pain relief options during labor. This is a key part of your plan, and it's important that you feel informed and comfortable with the choices available. Have you given any thought to whether you'd like an epidural, which provides significant pain relief but is more invasive, or would you prefer to start with less invasive methods first?
I've been thinking about it a lot, and I'd like to avoid an epidural if possible. I'm hoping to manage the pain with gas and air initially and see how that goes.
That's a great approach, and it's quite common to start with gas and air, which can be very effective for many women. It's a lighter form of pain relief that still allows you to remain in control and mobile during labor. We'll have the gas and air readily available for you whenever you need it. And remember, you can always let us know if the pain becomes more intense and you feel you need something stronger as your labor progresses. It's all about finding what works best for you in the moment, and we're here to support you every step of the way.
You hear a senior nurse briefing a junior nurse on a patient's condition.
Mrs. Thompson's wound is healing well, which is a positive sign, but we need to remain vigilant because it's still at risk of infection, especially given its location and the nature of the surgery she had. And it's crucial that we continue to manage the wound carefully to prevent any complications. Make sure to change the dressing daily, ensuring that the wound is properly covered and protected. Also, keep a close eye on the area for any signs of redness, swelling, or increased warmth, which could indicate the onset of an infection. If you notice any of these symptoms, report them immediately so we can take appropriate action.
Understood. I'll keep a close watch on it. Should I be applying any ointment to the wound to help with the healing process, or is it better to leave it as it is for now?
At this stage, it's best not to apply any ointment. The wound needs to stay clean and dry to heal properly, and adding ointment could potentially interfere with that process. Just follow the standard wound care protocol, which focuses on cleanliness and regular monitoring. If there's any change in the condition of the wound, we'll reassess and decide if further treatment is necessary. For now, maintaining a sterile environment and being consistent with dressing changes is the priority.
You hear a general practitioner discussing a follow-up plan with a patient.
I've reviewed your recent blood test results, and there's something we need to address. Your cholesterol levels are higher than what we consider healthy, which puts you at increased risk for cardiovascular issues down the line. To help bring those levels down and reduce your risk, I'm going to recommend that we start you on a statin. This medication will help lower your cholesterol, but it's important to understand that medication alone isn't enough. We also need to make some changes to your diet. Specifically, reducing your intake of saturated fats, which are often found in foods like red meat, butter, and cheese, is crucial. At the same time, increasing your consumption of fruits, vegetables, and whole grains will provide the nutrients your body needs to manage cholesterol levels more effectively.
I've been trying to eat healthier, but honestly, it's hard to know what's best. There's so much conflicting advice out there, and I'm not sure what changes would be most effective.
I completely understand it can be overwhelming to navigate all the dietary information out there. That's why I'm going to arrange for you to meet with our dietitian. They specialize in creating personalized meal plans and can help you develop a more detailed and manageable strategy that aligns with your health goals. The dietitian will work with you to identify foods you enjoy and make adjustments that you can stick with long term. In addition to dietary changes, I also want to emphasize the importance of regular exercise. Incorporating activities like walking, swimming, or cycling into your routine can significantly boost your efforts to lower cholesterol. Even moderate physical activity can make a big difference in improving your heart health and overall well-being. Together, these lifestyle changes and the statin should help us get your cholesterol under control.
You hear a mental health nurse talking to a patient about their treatment.
I just wanted to take a moment to acknowledge how well you've been doing with your therapy sessions. Your commitment and effort are really paying off, and I can see significant progress in your mobility and overall strength. It's clear that you've been working hard, and that's great to see. I also wanted to check in with you about the new medication you started. How are you finding it so far? Any noticeable changes?
Thank you. I've been trying my best. The medication has definitely been helpful in managing my symptoms, but I've noticed something lately. I've been feeling more tired during the day, almost like a persistent fatigue. It's starting to affect my daily routine a bit.
I'm glad the medication is helping with your symptoms, but I understand how frustrating it can be to deal with that kind of fatigue. Feeling more tired during the day is actually a common side effect with this type of medication. It's something we definitely need to address because your energy levels are important for your overall recovery and well-being. We might need to look at adjusting the timing of your doses to see if that helps minimize the tiredness. For instance, if you're taking it in the morning, we could consider shifting it to a different time of day. We could also explore other strategies to manage the fatigue,
such as incorporating short breaks or light physical activity to help boost your energy. Let's keep a close eye on this over the next few days, and if the fatigue continues or worsens, we'll reassess and find a solution that works better for you. Your comfort and ability to maintain your routine are top priorities.
You hear a speech therapist discussing a child's progress with a parent.
I'm really pleased with Emily's progress so far. She's made significant strides in her speech clarity, particularly with her S and R sounds, which are often challenging. It's clear that the practice and dedication she's put in are paying off. We'll definitely continue to focus on these sounds to reinforce what she's already achieved. However, as she's improving, I think it's a good time to expand our focus a bit. I'd like to introduce some new exercises that will help enhance her overall sentence structure. This will support her in forming more complex sentences, which is an important next step in her speech development.
That sounds really positive. I'm glad to hear she's doing well. I just want to make sure we're balancing everything. Will adding these new exercises mean she'll need to have more sessions each week?
Not necessarily, so no need to worry about overloading her schedule. We can integrate these new exercises into her existing sessions. This way, we're building on the foundation we've already established without adding extra pressure. I'll also provide you with some activities that you can do together at home. These home exercises will reinforce what we work on during our sessions and help make the new concepts stick. They're designed to be simple and fun, so they should fit into your routine easily. The key is consistency, and with your support at home, Emily will have even more opportunities to practice and continue her progress. We'll review how she's doing with these new exercises in our upcoming sessions and make any adjustments as needed.
You hear a nurse giving instructions to a patient who is about to be discharged.
Before you head home, I want to go over a few important things regarding your wound care. Keeping your wound clean is absolutely crucial for ensuring it heals properly and to prevent any complications. You'll need to change the dressing every day, even if it looks clean, because this helps to reduce the risk of infection. Also, it's essential to keep the area dry, avoid getting it wet, particularly when you're showering or bathing. Until the wound is fully healed, you might need to cover it with a waterproof bandage or use a plastic wrap to protect it from moisture.
I'll do my best to follow those instructions, but what should I do if it starts hurting more than it does now, or if it looks like it's getting infected?
That's a very important question. If you start noticing increased pain that doesn't seem to go away or gets worse, or if you see signs like redness spreading around the wound, swelling, or any unusual discharge like pus or blood, those could be signs of infection. In that case, it's crucial not to wait until your next scheduled appointment. Contact us immediately so we can assess the situation and provide you with the necessary care. Sometimes, catching these issues early can make a big difference in preventing a more serious infection. So keep an eye on the wound daily, and don't hesitate to reach out if anything doesn't seem right.